Imagine sitting in a chair while someone drills into your tooth with a bow-powered tool. No Novocaine, no laughing gas, just the whir of a flint bit against enamel. This wasn't a scene from a medieval torture chamber. It happened over 9,000 years ago. Ancient civilizations from the Indus Valley to Egypt to the Etruscans performed dental procedures that would not look completely out of place. The earliest known dentist was a man named Mehrgarh, an Egyptian scribe and physician who lived around 2600 BCE. His tomb inscription lists him as the greatest of those who deal with teeth. But long before Mehrgarh, people were already trying to fix their teeth. In Pakistan's Indus Valley, archaeologists found teeth with holes drilled into them, perfectly round, conical holes made with tiny flint drill bits. These holes were not for decoration. They were for removing decay. The Etruscans, who lived in what is now Italy, were masters of dental prosthetics. Around 700 BCE, they crafted bridges and partial dentures from gold and human teeth. They would extract a tooth from a living person or a corpse, file it down, and attach it to a gold band that fit over the remaining teeth. These early dentures were not just functional. They were also a status symbol. The wealthy would show off their gold-filled smile. But ancient dentistry wasn't all about drills and gold. The Romans had their own recipe for toothpaste, a mixture of crushed bones, oyster shells, and honey. They also used urine as a mouthwash. Ammonia in urine helped whiten teeth. Meanwhile, in China, the first toothbrush appeared around 1600 CE, made from hog bristles attached to a bamboo stick. Before that, people chewed on twigs or used their fingers. The journey from flint drills to modern dentistry is a story of place in a modern clinic. They drilled cavities, placed fillings, and even built bridges out of gold. The evidence comes from actual skulls with drilled holes, ancient texts describing toothworms, and surviving dental appliances made of gold and wire. These discoveries force us to rethink what pre-modern medicine was capable of. The oldest known dental drilling dates back to the Neolithic period, around 7,000 years ago in what is now Pakistan. A Stone Age dentist used a flint-tipped bow drill to bore perfect holes into living teeth. The holes were so precise they could only have been made by a skilled practitioner. This was not primitive butchery. It was deliberate, effective. Ancient Egyptians also practiced dentistry. They used a mixture of ground pumice and vinegar to clean teeth, and they made fillings from a paste of resin and malachite. A surviving Egyptian jaw shows a gold wire holding a loose tooth to its neighbor. The Etruscans, who lived in Italy before the Romans, were master dental prosthetists. They crafted bridges and partial dentures from gold and human teeth. Some of their work is so well made it could still function today. These ancient dentists understood occlusion, the way teeth fit together, and they built their appliances accordingly. 7,000 BCE. In what is now Pakistan, archaeologists found teeth from a graveyard in Mehrgarh that showed tiny, perfect conical holes. These holes were not caused by decay or wear. They were drilled by human hands using flint-tipped bow drills. The precision suggests the drillers had steady hands and an understanding of tooth anatomy. The teeth showed signs of the drilling being performed on living individuals, as the holes had evidence of healing around the edges. The drill used was a simple bow drill, a tool that spins a flint tip by moving a bow back and forth. This same technology was used for fire making and bead drilling, but applying it to a living person's tooth required immense control. The drillers had to work quickly to minimize pain, yet precisely enough to avoid hitting the nerve chamber inside the tooth. The holes were likely made to remove decayed tissue or to release pressure from an abscess. This early dental work was not just about drilling holes. The same teeth showed evidence of fillings. A mixture of bitumen, a natural tar, and plant fibers was packed into the holes. This is the oldest known dental filling in history. It suggests that these ancient people understood the concept of sealing a cavity to prevent further decay. The Mehrgarh findings push back the history of dentistry by thousands of years. They show that the desire to treat toothache is as old as civilization itself. These early dentists, working with simple tools and natural materials, performed procedures that would not be seen again for millennia. Their legacy is a reminder that the drive to heal is a fundamental human. Living patients, the enamel had been smoothed by chewing after the procedure. This was not post-mortem experimentation, it was real dentistry. What motivated these Neolithic people to drill into their teeth? The most likely answer: tooth decay. Cavities caused pain, and drilling may have been an attempt to remove the infected tissue, much like modern fillings. The drill bits were made of flint, hard stone that could be shaped into a sharp point. The drill was likely rotated by hand, perhaps using a bow drill mechanism. Imagine the pain and the risk of infection, yet these early dentists persisted. The drilled teeth show signs of healing, meaning patients survived the procedure. This was not torture, it was therapy. The Neolithic dentist was a skilled practitioner, probably a shaman or a healer who understood the connection. But why did tooth decay become a problem in the Neolithic? The answer lies in the agricultural revolution. As humans shifted from hunting and gathering to farming, their diet changed dramatically. They began eating more grains and carbohydrates, which stuck to teeth and fed bacteria. The result? More cavities. The drilled teeth from Pakistan are some of the earliest evidence of this dietary shift. They show that even 9,000 years ago, people were suffering from the same. So the next time you sit in a dentist's chair, remember, you are part of a tradition that goes back thousands of years. The tools have changed, but the goal remains the same: to relieve pain and preserve teeth. The Neolithic dentists of Pakistan were pioneers. They drilled into living tissue with flint and patience, and they succeeded. Their work is a testament to human ingenuity and the timeless desire to heal. The bow drill could achieve speeds of up to several hundred revolutions per minute, enough to cut through enamel in minutes. Ancient Egypt provides some of the earliest written records of dental problems and treatments. The Ebers Papyrus, dating to around 1550 BCE, contains prescriptions for toothache and gum disease. One remedy involved mixing ground cumin, frankincense, and yellow ochre into a paste applied to the tooth. Another called for the tooth to be fumigated with the smoke of burning seeds. Egyptians also believed in the toothworm theory, the idea that a worm inside the tooth caused decay. This belief persisted in many cultures for thousands of years. Despite their remedies, actual surgical intervention in Egypt seems limited. No clear evidence of drilling has been found in Egyptian mummies. The first clear evidence of dental drilling comes from the Indus Valley civilization, around 7,000 years ago. Archaeologists discovered teeth with perfectly drilled holes, likely made with a bow drill tipped with flint. These holes were surprisingly precise, between 1 and 3 millimeters wide and up to 3.5 millimeters deep. The procedure must have been excruciating, yet the teeth show signs of healing, meaning patients survived the operation. Been found in Egyptian mummies, though they did practice tooth extraction. The Egyptians valued dental aesthetics. They used a mixture of crushed eggshells, myrrh, and pumice as a toothpaste. Some mummies show signs of dental work like gold wire to stabilize loose teeth. Returning to Mehrgarh, the evidence of drilling is not isolated. Over a dozen teeth from the site show drilled holes, some showing signs of healing, indicating the person survived the procedure. As small as 1 millimeter in diameter. The holes were likely made using a bow drill with a flint tip. Experiments have shown that such a tool can drill through enamel in under a minute with practice. What is remarkable is that the drilling was done on both molars and premolars, suggesting the dentists could access different parts of the mouth. The holes were drilled in living patients, as evidenced by the presence of wear facets on the tooth surfaces. This means the patients continued to chew with these drilled teeth for years after the procedure. The drilling was not just decorative, it was functional. Some holes show signs of having been filled with a resin-like substance, possibly to seal the cavity or reduce pain. The resin used was a natural tar-like substance derived from birch bark. Birch bark tar has antiseptic properties and would have helped prevent infection. This early form of dental filling is remarkably similar in concept to modern composite resins. The ancient dentists of Mehrgarh were not just drilling holes. They were performing a sophisticated medical procedure that combined mechanical skill with This discovery pushes back the history of dentistry by thousands of years. It shows that the desire to treat tooth decay is not a modern phenomenon. The people of Mehrgarh, living in a Neolithic settlement, had already developed specialized tools and techniques for dental care. Their work represents one of the earliest known examples of curative dentistry, a practice that would not be seen again, conical, matching the shape of the drill bit. No evidence of fillings has been found in these teeth. It seems the drilling was a treatment in itself, perhaps to release pressure or remove decay, but the hole was left open. This raises the question, did the patient survive? The smoothed edges of the holes indicate they lived for some time after the procedure. Dentists were skilled, but they lacked anesthesia. Patients likely endured excruciating pain, yet the survival rate was high enough that the practice continued for centuries. The Indus Valley civilization also had advanced dentistry. In Mehrgarh, Pakistan, archaeologists found teeth with drilled holes dating back 9,000 years. These are the oldest known examples of dentistry. The drills used were tiny flint heads attached to a bow drill. The process was slow and painful, but effective. Drilling technique was similar to making beads. The same bow drill technology was used to create holes in stones and shells. Dentists simply adapted it for teeth. This shows how early humans transferred skills across crafts. The discovery at Mehrgarh also included evidence of tooth extraction, but drilling was more common. The holes were often in molars, suggesting they targeted cavities. Without fillings, the open holes would collect food, but the smoothed edges show the teeth were used for years after drilling. So the treatment worked. Practice spread to other ancient cultures. In Egypt, mummies show evidence of dental work, though less invasive. The Etruscans in Italy made false teeth from animal bone and gold. But the Indus Valley dentists were pioneers. They performed the first known dental procedures. Their tools were simple, but their understanding of oral health was advanced. They knew how to remove decay and relieve pain. The legacy of these ancient dentists is still felt today. Modern dentistry owes a debt to those early innovators. Dentistry could be successful, at least in the short term. In ancient Mesopotamia, dental problems were often attributed to supernatural causes. The legend of the toothworm is a Sumerian text that describes a worm sent by the gods to cause tooth decay. The treatment involved a combination of incantations and practical remedies. Beer, oil, and plant extracts were applied to the tooth. A priest chanted spells to drive the worm away. This blend of magic and medicine shows how early civilizations tried to understand and treat dental pain. The toothworm belief persisted for centuries, appearing in ancient Greek and Roman writings, and even in medieval European texts. It wasn't until the 18th century that the idea was finally disproven by modern science. Meanwhile, in ancient Egypt, dental practices were more advanced. The Edwin Smith Papyrus, dating to around 1600 BCE, contains detailed descriptions of dental ailments and treatments. Egyptian dentists used a mixture of honey, herbs, and minerals to fill cavities. They also performed rudimentary extractions and even attempted to stabilize. The Etruscans, who lived in what is now Italy, were also skilled dental artisans. They crafted partial dentures from human teeth and gold bands as early as 700 BCE. These early prosthetics were both functional and decorative. The Romans later adopted and refined these techniques, using gold crowns and bridges. Roman law even regulated dental practice, showing that oral health was taken seriously. A priest recited spells to drive the worm away. Mesopotamian medical texts also describe tooth extraction using a tool called a nail, possibly a lever or forceps. They recognized that a loose tooth could be removed to relieve. The Code of Hammurabi, from around 1754 BCE, even includes a law about pulling teeth. If a physician pulls a tooth and causes an infection, his hands would be cut off. This harsh penalty reflects the high value placed on successful medical treatment and the serious consequences of failure. Dentistry was not yet a separate profession. Barbers and general physicians performed extraction. The ancient Egyptians also had dental practitioners. The Edwin Smith Papyrus, dating to around 1600 BCE, contains instructions for treating loose teeth by binding them with a mixture of honey and crushed herbs. They even used gold wire to stabilize teeth. Hand may be cut off. Dentistry was taken seriously. The Etruscans, who lived in what is now Italy from about 800 BCE, were among the most advanced ancient dentists. They created dental bridges and partial dentures that were functional and aesthetic. Etruscan dental bridges used gold bands that were wrapped around adjacent healthy teeth to anchor a replacement tooth. The replacement tooth, often made from animal or human teeth, carved to fit. The gold bands were hammered thin and then carefully shaped around the anchor teeth. This technique required great skill. The result was a stable, long-lasting replacement that could withstand chewing. The Etruscans also made complete dentures for people who had lost all their teeth. These were carved from a single block of ivory or bone, with gold wire or bands holding them in place. Etruscan dentistry was not just for the wealthy. Archaeological finds show that people from various social classes had dental work. The Etruscans also used gold fillings to repair cavities. They would clean out the decay and fill the hole with gold. This prevented further damage and relieved pain. Their understanding of dental health was remarkable for the time. The Etruscan approach to dentistry influenced later civilizations, especially the Romans. Roman dentists adopted many Etruscan techniques, including gold bridges and fillings. The Etruscans left behind a legacy of practical, effective dental care that would not be surpassed for centuries. Their work shows that the desire for a healthy, functional smile is not often made from an animal tooth or carved from ivory. These bridges were not just cosmetic. They allowed the wearer to chew properly and prevented adjacent teeth from shifting. The Etruscans understood the mechanical importance of Etruscan dental work was so sophisticated that later Roman dentists adopted and refined their techniques. Gold dental appliances became a status symbol in ancient Rome. These bridges were not just cosmetic. They allowed the wearer to chew properly and prevented adjacent teeth from shifting. The Etruscans understood the mechanical importance of replacing missing teeth. Gold dental appliances became a status symbol in ancient Rome. Wealthy Romans would show off their gold teeth and bridges as a sign of affluence. Greek physicians like Hippocrates and Aristotle wrote about teeth. Hippocrates described the stages of tooth decay and recommended extraction as a last resort. He also noted that teeth are the only bones that grow throughout life. Aristotle believed that tooth decay was caused by the accumulation of food residues, a theory not far from modern understanding. He also thought that men had more teeth than women, which is incorrect. Hippocrates also described the process of teething in infants, noting that it could cause fever and diarrhea. He recommended gentle rubbing of the gums to ease pain. These early observations laid the groundwork for dentistry, even though many ideas were later proven wrong. The Greeks' systematic approach to medicine influenced generations of healers. Roman dentistry was practical. The Roman physician Celsus wrote detailed instructions for tooth extraction, including the use of forceps and the importance of Romans also used various pain remedies. Opium, henbane, and mandrake were applied topically or ingested to dull the pain of dental procedures. These were effective but dangerous in high doses. The belief that men had more teeth than women was a mistake that persisted for centuries.